A trip to the ER ended with a surprise medical bill for one Kansas woman. It came as a big shock since her visit was related to COVID, something that should have been covered by insurance. I-Team reporter Kat Reed got answers for that viewer and shares what steps you can take if you find yourself in a similar dilemma.
I was having shortness of breath. I was coughing, just kind of feeling achy all over.
Angie Abbott was scared on the November day when she started experiencing those symptoms, signs she could have contracted COVID-19. She decided to go to St. Luke's Community Hospital on Johnson Drive.
Before I arrived there, I called my insurance company and they said they were in network, and because it was COVID related, it would be covered.
The CARES Act required insurance companies to cover COVID tests and diagnostic visits without passing costs on to customers. Angie's insurance company, Cigna, spells that out on its website, saying it's waiving out-of-pocket costs for COVID-19 visits with in-network providers.
They tested me for COVID and x-rayed my lungs to make sure they were okay.
The good news, her COVID test came back negative.
Definitely wasn't expecting what was to come next.
The bills.
This is the first one.
Saying she owed St. Luke's $1,200.
So I called the insurance company. This was the first time I called the insurance company, and they said, you will not receive any more bills. You're not going to have to pay anything for this because it was COVID related.
But the bills kept coming.
This is your final notice for passing this to a collection agency.
Angie says her insurance company told her that she was on the hook for that amount.
I feel like I'm stuck in the middle.
Angie planned to use her stimulus check to cover the bill. But first, she reached out to the 41 Action News I-Team, and we got in touch with Cigna. The insurance company told us the bill was a mistake. In a statement, a spokesperson wrote, "People deserve protection and peace of mind when it comes to their health. The outstanding claim has now been adjusted and covered at 100% with no charge to the customer." Cigna says both patients and healthcare providers can appeal coverage decisions if there's more information they'd like Cigna to consider. In this case, there was no formal appeal. The company also encouraged customers to reach out to a provider's billing department to negotiate a lower bill and to discuss any financial assistance programs that may be available.
And then it's just a charge for the emergency room.
Angie is thrilled she won't have to foot this bill, and she's happy she spoke out.
I didn't want this to happen to other people.
St. Luke's health system says it's relieved to see there was a resolution in this case. A spokesperson said if you think you've received a bill in error, always reach out to the health system and keep in mind your doctor can be an advocate in the appeals process. For the I-Team, I'm Kat Reed, 41 Action News.